All right, welcome back everyone to Tattoos and Telehealth. We have the great Nicole Baldwin and I am Kelly White. We're going to chat with you all for a little bit about some of the experiences we have in telemedicine, which can be anything from the best of the best and hilarious and funny to just some weird stuff. So Nicole, what are we talking about today? Where are we going? What are we doing?
Yeah, so just for a little bit of clarity, Kelly and I, we are colleagues. We're both nurse practitioners. We practice very, very different realms of medicine. We're both family nurse practitioners. We're both multi-state licensed. But I was talking to Kelly last week, and what she does for telehealth is just amazing and super, super intriguing and honorable. She puts a lot into each patient. And so I just wanted you guys to hear what she does and how you can reach her and what she offers, and we'll go from there.
Oh, thanks, Nicole. So I'm going to back up and kind of explain why I decided to go this route. So telemedicine offers a plethora of things that we can do with our patients. So we have a lot of offerings, but one of the things I think that really grabbed my attention right now is that, I've said before, I've been in medicine for so long. I've been doing this for about 20 years. I've been in telemedicine more recently now, I guess, for 3 years. But what really grabbed my attention is as I've gotten older, I'm on the other side of 40 and we'll leave it at that, is that as I've gotten older, I've become a little bit more needy in the world of medicine. And, things are changing. As I've gone to my primary provider, I feel like I'm lacking in getting things done. I go and see him and it's like he overlooks things or doesn't call me back or doesn't take care of stuff that I feel like are important. And that's frustrating. I get my lab results before he does, which that's a flaw in the system, not his fault. But then I never get a call. And I'm like, is this because I'm a provider and he just assumes I'm going to take care of myself, which that's unfair,
Yeah.
Or is this happening to his other patients? And I noticed this also with some of my friends. They feel like they're not being treated with certain conditions, or they'll call me with their labs and say, hey, I got my labs back, but my doctor's office hasn't called, or they just kind of mentioned this, but then didn't treat it, or should I be worried about XYZ? And
Yeah.
just, Nicole, it's just so frustrating. I know primary providers are so overwhelmed and there's just so much going on. And we live in a fast-paced of now society. And I won't knock on any particular form of that, but I do know that we're a very results-driven society right now. We want things yesterday, right? But I also know that for me personally, my peace is found in exercise and my private time and my personal time. I've always been the kind of person that was like, my me time is when I'm getting an opportunity to go work out, even just for 30 minutes. And I took that a step further to say that if I take the time to focus on me and spend just a little bit of time doing something for myself, I feel better. So I kind of started digging into that, and I did a whole lot of research, and I stumbled across what we used to call back in the day holistic medicine or naturopath or things like that. But they've really taken that in medicine a step further and created something called functional medicine, which, when you take a look at functional medicine, it really digs all the way down to the root cause of what's happening. So if you picture a giant tree that's maybe dug itself down way down. And you imagine what we always taught our kids growing up, where the roots of the tree are double the height of the tree. Well, there's a reason for that. It's because they extend way out to make sure that the tree always has a supply of something. So in functional medicine, we dig way down to figure out what's going on. And that's what I had mentioned to Nicole a while back when we were chatting, was my first visit with a new patient can literally take 2 hours. And the reason for that is I will spend all of this time going all the way back to when they were babies, maybe sometimes even in utero. I'll find out, did mom have complications during pregnancy? Did she have a normal delivery? Was it complicated? Was it stressful? Was it induced, or did she go into natural labor? Was it a C-section? Was there complications after delivery? Were you in the NICU? And I will literally go back that far to figure out what stressors were there even then. And that gives me a really good opportunity to figure out what kind of inherent stressors have been born into my patients that they've carried through their whole lives. Because, as we know, stress is a very, very real predictor of health. very real predictor. And stress also regulates your cortisol. And if you don't take a step back to think, well, your cortisol very much regulates what we call an HPA axis. So your hypopituitary adrenal axis. And so if you don't take that into consideration, then you also don't think about your hormones, like something simple, your thyroid. Every patient is very aware of their thyroid. There's much more to it than that, but every patient is very aware of their thyroid. And that's a simple one to key up on. And so by being able to dig all the way back to that, I can literally decide, where do I need to plug in and figure out what's truly happening with my patients. And it may be something as simple as dealing with just one stressor, just one. I may have a patient that says, oh, well, I get, 5 hours of sleep at night. And, maybe he's 60 years old and he runs his own business. And he's like, it's what I do. I get 5 hours of sleep at night. I'm up at 4:30 every morning and I do this, this, and this. And it's what I've always done. I get 5 hours of sleep at night. And that's normal for me. Well, that may be normal for you, but that's not normal. Okay. Studies have shown multiple times, and it's reproducible over the years, that the average person needs 7 to 9 hours of quality sleep every night. Period. You just do. And if you're not getting it, you may call it normal for you, but it's still not normal, and it still creates a stress response in your body, and it still leads to all of these other things downstream. And I can go through all the stresses with these patients, and even if I can just fix one, tackle one every month with that person, I can start to lead them in the process of healing some things that maybe they were just given medications for. And it's a really powerful thing for me. Like,
I love it. I love it.
I love it. I'm smiling ear to ear because I just can't stop smiling, because it's something that I think people take for granted in thinking, oh, well, I'm old now. I have high cholesterol. I just have to take a pill just because I'm getting older. I'm getting older. I have high blood pressure. I just have to take these pills. Well, no, you don't. I mean, maybe you do, but maybe you don't. Let's figure out if there's something else there that we can kind of start tweaking and working on. And it's just so powerful, because you get into the roots of all the little things, and you really get to know that person, and you establish this trust and this relationship with this person. And, at the end of the day, it's so incredibly rewarding, and we get to do it all via telemedicine, right?
You know your patients, like you truly know and connect with your patients beyond the standard patient-provider relationship.
Yeah, it's fantastic. And the great big part that I love to take away from this is I'm doing it via telemedicine. So they are seeing me in a space that's also comfortable for them. If it's in their home, on the couch, maybe it's from the seat of their car pulled over on the side of the road because that's where they were in the moment. Like, it's something it's a very safe space for them as well. They're not having to come into and this is nothing against brick and mortar settings, because you and I did this for years of our career, but they don't walk into a sterile smelling environment with people they don't know and strangers putting their hands on them. And you know what I mean? Like, they get to feel comfortable because there's not a weird person in front of them that's touching them and doing all the things that maybe they're not comfortable with. It's amazing.
It's amazing because, number one, they're going to get you every time.
Correct.
Like, patients know that if I have a scheduled meeting with Kelli, it doesn't matter if I'm in bed, doesn't matter if I'm at the office, doesn't matter if I'm in the car, not driving, doesn't matter where I'm at. I know that I'm going to see Kelli. Like, I'm going to see her. And we have already talked about this, this, and this. I remember something you touched on that really resonated with me. And I thought, you know what? So many people probably can relate to this. You had seen a patient, or you were talking to me about something, and it was like this patient had hypertension, they had trouble sleeping, they had high cholesterol, they were a male, which gives them another point, but their issue was, it was sleep apnea driving all of that. Like, sleep apnea in itself it was driving the hypertension, it was driving the daytime fatigue, it was driving all of this. And like, patients don't know that. Like, they don't know that's even a thing that can cause all of this stuff, but that's something you just figure out.
Yeah. Yeah. And you just spend a little bit of time visiting with them. But I feel like in a lot of other spaces, that time is not allotted. And again, this is not to throw shade on any other practice, but primary providers just don't have that option.
It's not their fault.
No.
They're driven by, you have 10 minutes or 15 minutes to see the patient. That's from saying hello to here's your whatever, XYZ. See you later, on to the next patient. It's medicine. This is not provider specific. This is medicine. But Kelli has created her own environment specific for patient needs. And if you need an hour, if you need 2 hours, I think that's a huge deal. Like having a healthcare provider, licensed board certified healthcare provider, take whatever time you need as a patient. I just think that's incredible.
The major drive there is, again, I've said this before, I'll say it again, Kari Health is meeting you where you are.
I love it.
Because that's what I needed. And the moment when Kari Health was born, it's what I needed. And so I had no choice but to give it to my patients because that's what they needed too. Like you said, my faith means a lot to me. And it was the Lord's way of saying, if you need it, someone else does too.
Mm-hmm.
And so it's just a matter of sitting back and listening to them. And by being able to realize this patient has sleep apnea, that's driving all of these other things. Well, why does he have sleep apnea? So then we back up and we fix the reasons why he has sleep apnea and or treat the sleep apnea. Well, then the other things start to fall in line as well. And maybe we can take him off some of the medications that are causing complications because he has to take them. His cholesterol medication was causing joint pain because that particular cholesterol medication breaks down the lubrication of your joints and causes joint pain. So, a lot of things that we can talk about, and it provides a great opportunity for patient education. I mean, Nicole, when was the last time, truly, honestly, Nicole, when was the last time you were able to sit down with a patient and spend as much time as you wanted in patient education?
I can say it's definitely not often now because my practice is very different. However, I do have times when I can do that, but it isn't near as often. And because I treat more urgent care, bridge care, not functional medicine, I don't have that time. But I could have that time in this setting. You know what I'm saying? And so in brick and mortar, never.
Yeah.
Never. In the hospital, in the clinic, never. Because it's always about how many patients you can see, because you have to meet some kind of something, right? You have to check so many boxes or whatever the case may be. But it just doesn't happen. It doesn't even happen in my world now. So the fact that you offer that, I think it's great. I mean, it's just amazing. I'm more of a, do you want me to help you with weight loss, which you can do that as well? So that kind of overlaps. Do you want me to follow you with weight loss? Am I treating your sinus infection? Am I just refilling your meds because you're traveling or whatever? So it's not my realm, but I will say that it could be my realm, like you've made it your realm. And I think that's just incredible that you offer that, because unless we make space as providers like you've done, there's no way it can happen. There's just no way, because it's just not the way the world turns, unfortunately. Nobody that I know does that, actually, except for you, that takes that time.
Yeah.
That's huge. That's really, really huge. I mean, sometimes we know if you treat the underlying disease, the reason for it, then we're not just taking a pill for a pill for a pill for a pill. And I'm not again, I practice Western medicine. I prescribe. That's not what I'm saying. What I'm saying is that if somebody has hypertension, obesity, blah, 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 and they've got a pill for this and a pill for that, and this they just have to deal with because this is just how they're built or whatever the case may be, whatever they're told. But you find out this is all rooted from this. If you can fix this stuff can eventually be tapered off to maybe not even need it. Like, you're truly looking at those roots, like the tree or the iceberg. Let's fix this underneath. Like, let's not just put a Band-Aid on it per se. Let's fix the problem. I think that's incredible.
Yeah, absolutely. It has not only offered me an opportunity to reach peoples that I think needed that, but it's also filled that void in me. It's also allowed me to fill that emptiness in me, that thought, why isn't this a thing?
How many times have you heard, and I hear it a lot, and so that's probably why I'm so drawn to this. I don't do primary care, but people, whether it's family, friends, colleagues, patients, whatever, my primary care just doesn't listen. And this is not it. And this is, I'm not throwing shade at primary care, but they just aren't a lot of the time. It's the nature of the beast. It's no one's fault. It is what it is, right? It's just the way medicine is. It's not one person's fault. It's across the nation, right?
Yeah.
But my primary doesn't listen to me. I got my lab work back and they said, oh, okay, they're fine. This is high, this is low, whatever. But what does that mean? What does that mean? Like I've discussed before, your labs are normal, but that shows me you don't have anemia. You don't have any sign of leukemia. Your heart functions on potassium and sodium. So when that's out of whack, like it's a huge red flag. So for me to just say it's normal, but what does that rule out? And so you take that time to say, okay, this is what's abnormal. This is why, this is how it's abnormal. How do we fix it? Even if things aren't abnormal, let's educate on why we run these tests and how important they are. Because I feel like when patients, even humans, I feel like when humans know why you're doing something, they're so much more likely to be a part of their care, right? There's so much more to patients. They're more likely to be compliant when they know why they're doing something.
Sure. Oh, and then that's the other piece of functional medicine that has become so near and dear to me. And I know that you understand this is normal is just what the lab says is an acceptable range. It doesn't mean that's where you feel good. I preach this to my patients with vitamin D levels, especially. So vitamin D levels in most labs, normal is anywhere from 30 to 100. That's a big range. 30 to 100. That's a
most patients are below 30.
Most people are below 30. Yeah. Most people live below 30. And that's because lots of reasons. One, we don't get out in the sun as much anymore. And two, when we do, we make you put on sunscreen. So you can't absorb the UV rays anyway, you know?
Yeah, there's no win.
Yeah, there's no win. But most providers will say, well, if you're above 30, you're normal, you're fine. You don't need to take supplements, you're fine. I find most of my patients, I want you between 60 and 80. Like I want you way up there on the high end of normal because that's where you feel good. That's where you have energy. That's where you don't feel drained at the end of the day. That's where you don't feel like you're just blah. And most of my patients, I push them to live between 60 and 80.
Wow.
Because that's where they tend to feel better. And so that's the other part of functional medicine is I don't care that you're in the normal range. I care that you're in a healthy range.
So let's talk about vitamin D for a second.
Well, yeah.
Vitamin D does not come in regular labs. It does not come with your CBC, CMP, lipid panel. It does not come in that.
If you don't ask for it, they don't draw it.
That's exactly right. If you don't ask for it, they don't draw it. Especially as women in our 40s, mid 40s. We just inherently as women, we have a decrease in bone density. That's a huge thing. I mean, men have their bones are important too, but women with the hormones and stuff, we should be running labs as a baseline on anyone, especially 40 and over, because otherwise you're going to have pathologic fractures and all this other stuff. But like, just for you to be on top of that, I think is incredible. I can't tell you the last time I even ran a vitamin D level on a patient. I can't tell you, but you probably do it as a baseline. Like if needed, you probably just do it that way. And I think that's awesome.
Yeah, for sure. Well,
very, very cool.
That's my big thing. So tell us what you do, Nicole. What gets you up out of bed? Tell us the name of your practice, what it is, what it lives for, what gets you up and running.
Yeah. So right now we are doing primarily urgent care, bridge care, which means if you're in between primary care providers, need a refill, whatever. There's a lot of weight loss out there right now. That's kind of the hype, you know, the GLP-1s, that's the hype. So we do that quite a bit. We follow patients along with that, but it's definitely more of a situational specific treatment. I don't do primary care because I don't have the time to remind patients, when was your last mammogram? When was your last colonoscopy? What vaccines do you need? Or whatever the case may be. Like I don't have the bandwidth to do that. And so I know what I'm not capable of. And that's it. I've been doing telehealth since 2019. So I've been doing this for, 5 going on 6 years, and I don't have the bandwidth right now. And I don't strive for that. I want to specialize in something, not the jack of all trades, master of none. I want to be the master of one or two. Yeah. And that falls in the lines of weight management. It falls in the lines of urgent care, pediatrics, that kind of thing. So when you have the sinus infection, when you have the UTI, if it's erectile dysfunction, I'm not your primary care, but I can play a part in your medical care. But it's always important to have a primary care. Always. If I have a visit with a patient and they are tachypnic, meaning they're breathing fast. They look like they're short of breath. They're, I'm having conversation and I can tell that they're conversational, dyspnea. They're struggling to get enough oxygen. They're kind of gray. Like, okay, you need somebody that can put a stethoscope on your lungs. Like maybe you need me for that direction and to whatever, and that's fine. And I can send you an inhaler or whatever you need. But in the meantime, you need to get to somebody who can really just, test you for the flu, test you for whatever. So there is certainly 100% of the time a place for primary care, and they're kind of like manage you. Not as deep as Kelli, I'll tell you that. I don't know any primary care that does that, but they manage you on a whole thing. And a lot of times with insurance, they're the gatekeepers and things like that. But I will refer to primary care. You know what? This is, I've treated you twice for a UTI within 90 days. I need you to follow up with your primary care or GYN because something else is going on, that type of thing.
That's something that they don't know. So, talk about that a little bit more. Is that something that you feel like people are aware of? Like if they have multiple UTIs, they just keep treating it? Or do you feel like that's also a service that you're providing to people by educating them that this is not okay? This is not normal.
Yeah, for sure. For sure. No, patients don't know. I mean, some of them know, and there's so much to Google out there. The problem is with Googling.
Dr. Google.
I know. Never substitutes Dr. Google for my 8 years of school.
Please don't.
Yeah. So that's a service. It's to say, look, I've treated you twice.
Yeah.
At this point, you need to see somebody in person, or if I treat you the second time, what I will usually say is, this is the second time I've treated you in 90 days. If symptoms don't resolve or worsen, you need to follow up in person. So a lot of times I try to avoid that, even that third. I don't want to waste your time with that third conversation. I don't want to have the option to tell you it's not a good idea for me to treat you. It's not appropriate. A lot of times we'll say that ahead of time. I'm going to treat you the second time, but if this comes back or doesn't get better, then you need to see in person, because patients that are smokers and they have a little bit of blood in their urine, which maybe is not visible to the eye, then we start to look for, okay, do they have bladder cancer? Like there's other things that a urine test would test for that, unless I send one for you to get done and then get the results back, which I do, really a primary care provider is really needs to just lay eyes on you. They really just need to lay eyes on you. And primary care providers trend, is your hemoglobin dropping every single 6 months? That dropping a smidge? You're still within normal, but it's dropping. They trend those things. So I do order labs. I do send referrals.
That's all via telemedicine. You can do that.
All via telemedicine. We talked about it the last podcast. We can do work notes. We talked about that. My company, Hamilton Health and Wellness, which is HamiltonTelehealth.com, is very much driven on what can I help you with today and what can I continue to help you with. But it could really be anything. And also sometimes I have families. Hey, I've been seeing you for weight loss for the last 6 months. My daughter's 6 and she has a fever. Sure. Yeah, I can see her. Not a problem at all. Not a problem at all. Absolutely. But if it's something that I feel that is not appropriate for telehealth, which I don't a lot, then certainly I will send you. If it's a neurological thing, or if it's some kind of emergency, or I'm like, whoa, this is not okay. You think this is no big deal, but it is a really big deal because it could be this, I will send you to in person. I'll see you, but a lot of times I will send to in person, especially if it's warranted.
For sure.
But definitely here when you need us. I don't charge a subscription because I feel like I don't like subscriptions. So I just don't. Like, I'm here when you need me. You may need me today for medication refill, and in 3 months you may need me for a refill of your birth control or whatever. It's really more of a fee for service. I don't take insurance. I don't think Kelli does, because that's a whole other beast. Like, we just want to keep this simple for you. There's so many patients out there that either are underinsured, don't have insurance, live in a rural area where there's not really much options, or maybe you've never seen a doctor, that kind of thing. And that's where we say, okay, how can we help you from here? A lot of times I get tooth abscesses. I need to get in to see a dentist, but we know dentists won't a lot of times pull teeth or do whatever they have to do unless the infection's gone. So I'll say, okay, I'm going to give you this much antibiotics, but you need to see a dentist within this time so they can treat you. So there's so many things we can see telehealth for. There's so many things, but it is important to have a primary care.
How many providers are in your practice, Nicole? Is it just you and patients come back? Are they seeing you each time?
So I have a small, very intimate team. I have me, and then I have one other provider that is with me. She will see some of my video visits. If the state requires a video visit, they can schedule with me or with her, just because I want to make sure people are seen in a decent amount of time if your state requires a video visit. Most states don't, but some states do. And so we always want to make sure we're compliant with that. But outside of that provider, it is just me, and I do have nurses. I have an ER nurse and an ICU nurse that work for me. I have a prior authorization team. I had to hire that because when GLP-1s came out, don't even get me started on this, but just to make this a very quick statement, is that the nation, until we get to a place where we are trying to prevent things instead of treating it as an afterthought, prior authorizations have gone through the roof because insurances do not want to cover GLP-1s unless you are diagnosed with diabetes. But why are we waiting until patients are diabetic before we help them not be diabetic? Like, why? That's so frustrating to me. And so nonetheless, I've had to say, okay, we need to be able to submit this stuff to your insurance, to say what your risk factors are, what your BMI is, some of the things that you already struggle with, hypertension, PCOS, pre-diabetes. This is why you need this medication, because it's going to prevent any of this from advancing. And so through this whole weight loss big thing that's going on now with GLP-1s, I've had to hire a PA team. That's all they do is prior auths. That's all they do. They're on the phone with insurance companies. They're submitting data. That's all they do. I have an office manager, and we all stay connected through one program where we're communicating every day. We're on huddles every day. So it's grown to quite a big size team. But as far as providers, most 99% of the time you'll get me, unless you schedule specifically with another provider, with my other colleague. You'll get me every time. It's just how it goes.
Wonderful. And now when patients go to your website, do they can like just click on a link and schedule with you?
Yeah. So you go to hamiltontelehealth.com. You can click on Be a Patient. We're actually revamping our website, but you can click on Be a Patient, fill out some basic data, which is all going to a HIPAA compliant place, and we can just start messaging. I have a HIPAA compliant text messaging platform that you can just message us when you need something. I don't care if I haven't seen you in 2 or 3, 4 months, 6 months, 8 months. If you say, hey, I have a sinus infection. Okay, let's talk about it. All right, let's see what's going on. Anything change with your medical history, that kind of thing. So we can definitely get you care as simple as from your phone. Some states require the video visit, but those states are minimal. Most of the time we can do it over chat. Honestly, most of the time, it depends. It's very patient specific, but most of the time it's very quick, and it can be, your prescription can be sent or whatever needed within a few minutes.
I love it. I love it.
So what's your website? Spell it for me.
So mine is charihealth.com. So CHARI health.com. And it's the same thing. You can go on there and you can click the link to sign up, or I think it's schedule an appointment or something like that. And it sends you straight to a HIPAA compliant website. And it sends you to my scheduling link for my electronic health record. And you just schedule an appointment, and it automatically sends me a notification that there's a new appointment request, and we can take care of it immediately. Or you can click on contact us if you need something more immediate, and it'll shoot me a message and let me know that you need an urgent visit. So not only do I do functional medicine, but like yourself, Nicole, I'll do some urgent care visits if need be. So if I have a patient that's, whether they're established or not established, they do need an urgent care visit, I'll take care of those as well. It just tends not to be something that I do as often, but I do have those services for my patients as well. Weight loss is something that I do. I just tend to do it a little bit differently than what some of the other offerings are. I'm with you. I don't like the subscription services. I tend to focus a little bit differently. I approach it from more of a functional standpoint, like, macros and the way that they eat and the way that they get exercise and how they do things. And so I tend to approach it a little bit differently from the back end, but that's just the way that my mind works. And so I have all those offerings on there. So yeah, it's a great way. I love how the technology of telemedicine offers us so many ways to do it, right? Like you and I have worked for different platforms and different companies in telemedicine, and it's come so far, right? Like we can do different platforms of texting and messaging and chatting with our patients. We have different electronic health records that we can use, all HIPAA compliant, all very safe. And we can certainly do, I think we've planned to do an episode about HIPAA compliance and telemedicine. It's really come a long way, all the different things that we can do to care for our patients, the different video options and interfacing and things like that.
It's good. And we both have multi-state license, and I just wanted to touch on the rules change all the time. And so last year, I decided I'm going to get my master's in healthcare law. And so I'm right smack in the middle of that. And so, we will definitely need to have a chat about HIPAA compliance, a chat about all of those things, because some of the stuff, I mean, HIPAA is ingrained in our brain. When I'm old and senile, I will know what HIPAA is, because it's just engraved in our brain. But there is so much to it to make sure that we're in compliance. And, I don't know what I don't know. And so being a multi-state provider, I felt like the only way for me to feel comfortable with some of the topics, I'm like, I have to educate myself, and I know you do a lot of education, a lot of CEUs. That's always required. And you've done the extra functional medicine. So I'm really proud of you for going and getting certified in functional medicine. Like that's a huge deal. So on the other end, I'm trying to get my master's in healthcare law. And so that's why this relationship seems to be very symbiotic. We're just do the same thing, but different, same church, but different pews. And that's definitely, I like that. I like that a lot. In fact, as you're talking, I'm like, I have a few patients that are I call them my problem children, but where I'm treating them and the therapy is not, they're not yielding the results that are typical. And so now I'm like, hey, I can probably refer those to Kelli, because she's going to do all of the legwork on the back end to figure out, okay, why is this patient not responding to this therapy, which is 98% of the time, like, okay, what's going on? So as you're talking about what I'm like, hey, I need to really refer some people to you.
I think, Nicole, that's the other great thing about some of these relationships that we develop in medicine. My hat is off to you for doing the master's in healthcare law. So I looked into that a couple of years ago. It was all online, and my hat is just off to you. I love that you are willing to tackle that and get in the middle of it. And I will absolutely be picking your brain. And when we do an episode on that, I'm going to be taking notes like a mad woman, because it's like you said, we don't know what we don't know. And just the fact that you're going to have that knowledge there for you to be sure that your company is in compliance, that you're always doing what you're supposed to be doing, because healthcare law is a real thing and it's scary, especially when you don't know what you don't know and you're not being compliant, you're not practicing the way that you should, and you don't realize it until after the fact. And you're like, oh crud, I was supposed to be doing X and I was doing Z. And so it's important. And we are constantly trying to gain that knowledge and stay on top of it. And it's a full-time job in and of itself to stay compliant and stay on top of our CEs and stay on top of the things that are always changing. And, I think that the relationships that we form with other providers is so critical for those reasons. What can we do for each other? What do I know that I can give to you to help? What do you know that you can help with me? And how do we serve each other in those things? And I think that that's a relationship that we have to continue to foster in medicine, especially amongst other nurse practitioners, as we grow our practices, as we continue to thrive in an environment where we're trying to bridge a gap in healthcare.
Yeah. And we want to do what's right. But it's very difficult. The CEUs that are required for Texas are very different from Florida. Yeah. Now, sure, they're the same, but they're different. Like, if there's more than 5, but if there's 5 of each, 3 of them will be the same, but 2 of them will be completely different. Like, so we have to make sure that we are compliant with that, right? Just with that. So there's so much, like there's so much. And honestly, I got and still am sick of paying my attorney for stuff that if I can learn some of it myself and learn the ropes, I don't have to ask so much, right? So, it's always good to have a healthcare attorney, but I've just been paying him way too much money, right? So now, I had to write this like professional letter. I sent it to him and I said, can you just review this just to make sure I'm kind of on the right track? He did have some input, but it was very minimal. But it was like, instead of it being like a $2,000 bill, it was like $800 because he didn't have to write the whole letter, right? So it's just crazy. There's so much, and there's no way for us to know everything. So continuing our education in different ways, that means that we can collaborate and we can benefit from each other. And so, yeah, it is not easy. It's not easy. I just started another class yesterday and I was like, I worked all day and then I had a lecture in the afternoon, but I mean, it is what it is, and it will be done with, hopefully before I know it, but it's absolutely tough, but it's worth it because I want to make sure I'm safe. I want to make sure I'm compliant. I want to make sure my friends are compliant. Sometimes I'll have a conversation with somebody and I'll be like, no, that's a Stark law. We're not going to do that. There's different, but you don't know, like I don't know. So I'm trying to educate myself and serve others. That's what we do. We really, truly just serve others. And whether that's other nurse practitioners, doctors, patients, whatever that looks like, that's where we're at.
Yeah, for sure. So if you could give patients one takeaway today from our conversation, what would it be?
If you haven't done telemedicine and you're looking for something that can help you augment your current in-person care, reach out to someone, whether it's us or somebody different, a reputable company. There's tons of telehealth companies out there. Do your homework, make sure they're reputable, make sure it's somebody that you can follow, somebody that you can trust, because there's a lot of shady stuff in every field, right?
Yeah.
In
Yeah.
politics, in medicine, in whatever. There is always some shady stuff going on. So just do your homework and make sure that it's somebody that you can trust, that you can feel comfortable with, because there's some businesses that it's like herding cattle. The patients truly feel like they're cattle being herded through. That's, not how patient care should truly be. Unfortunately, it is in some cases, but I would probably say, give it a try. And
Absolutely.
when you do give it a try, do your homework before you do that.
Yeah, for sure.
What would you say? What would you say is your piece of advice?
My piece of advice would be to come with an open mind about what all can be accomplished via telemedicine. You'll be surprised. You'd be surprised what we can do for you. And don't underestimate what nurse practitioners in telemedicine can accomplish. I think very highly of nurse practitioners. I'm sure I'm biased, but I have worked for a lot of years in a lot of different fields as you have. And I think that we bring a lot to the table. We really, really do. I think that Nicole and I both have served some populations of people that were truly underserved, truly looked over, truly in need of someone to just virtually lay a hand on their shoulder and say, I got this, I got you, and we're going to help lead you through this moment. So I think that, as she said, if you've never done telemedicine, maybe you have and you had a bad experience, but don't let that one experience be something that turns you off. Give it a try, give it an opportunity to serve you, because I promise you there's so much more out there that maybe you weren't really expecting. So I think that even if you're afraid of it, give us a shout, comment, holler at us, chat with us, reach out to us on our websites. We're happy to answer any questions you have.
Yeah.
No question is a dumb question. I promise we've heard it. We've probably even asked it ourselves at some point.
I'm sure
we have. But yeah, just jump out there. There's a lot in the world of telemedicine, and we're more than happy. I think between the both of us, we can cover the gamut of telemedicine offerings.
Yeah, for sure. Well, thank you for today. Thank you for watching us and following us. And we'll make sure that our links are attached. If you need anything, please feel free to reach out. From a provider standpoint, if you're looking to get into what one of us is doing, you can also do that. We do offer some consulting services, and we'll see you next time.
Great. Bye, everybody.
Bye.